I think it's important for some of the activities to be a little bit more cultural based because I feel like a lot of that can be forgotten and it was kind of pushed to the wayside in the years. So some people don't know that that can be a healing path for them. How it feels to make a drum and how much focus there is behind it, and it can be healing for them. Some people don't know the connection that there historically was to the land, and that even just getting by the water can make you feel more comfortable with yourself or mentally a little bit more healthy and strong. So it reintroduces the culture to them to allow them to decide if this is a way that they heal. It might not be for everyone, but more often than not, our cultural events had a little bit of a higher turnout and a great success rate. Make sure everyone feels comfortable before you dive right into more sensitive topics. If you just dive into the sensitive topics, it can be a little bit discouraging for people who maybe don't know what they're coming in for. So I think it's better to kind of break the ice with something a little bit more fun, something that just brings people together and they can share a meal and some laughs before you get into the healing and the trauma. It also allows you to introduce the topics, letting them know what they might be in for the next one, or if there's a specific date set up for something that's a little bit more trauma-based, and that allows them to decide if they're ready to partake in that event.
People think that they understand addictions, people think that they understand mental health, but it's so complex. Through training as a peer support worker, I've learned more about mental health and addictions in the last year than I have ever known, and what happens in the brain when people suffer through trauma, when people suffer through grief, and how that can manifest in addictions and how that affects people's mental health. To be able to hear what it's like for a mother to watch her son struggle with addictions, and then on the other side to hear someone who himself struggles with alcohol addictions was so very powerful. And then you learn to let those issues slide away and you just see the person, right? You see them for who they really are. And I think that's a key thing in breaking down those stigmas in communities, because I think it's kind of just changing how we think we're helping. Just listening to someone, just smiling at someone, being on the other end of that phone call can make a huge difference. It's just changing the way we think about support and what that looks like, changing the way we look at our loved ones who are struggling.